Had a question from a teammate regarding finding relief from the symptoms of seasonal allergies. Seasonal allergies are otherwise known as allergic rhinitis or hay fever. Symptoms can include nasal congestion, sneezing, runny nose, etc. These symptoms are triggered when pollen and molds land on the lining of the nose, sinuses, throat, etc., and trigger these symptoms. There are several interventions that can be done to decrease the symptoms and give you relief. The first is reducing your exposure to allergy triggers during your allergy season. This can include staying indoors when pollen counts are high, and especially in the early morning when they are at their highest. Avoid gardening, pulling weeds, mowing the lawn when pollen counts are high. Keeping the windows and doors closed to keep the allergens out. Removing clothing immediately once you come indoors from outdoor work and take a shower to wash the allergens off your body. Purchasing a HEPA filter, HEPA filter, and leaving it on in your bedroom. Trying to remove carpeting from your bedroom and other areas where you spend a lot of time. The second intervention is there are several categories of medications that can help relieve symptoms. The first are the oral antihistamines. These work by decreasing histamine's ability to trigger symptoms. In the United States, these can include oral Zyrtec, Claritin, and Allegra. The second are the corticosteroid nasal sprays. Corticosteroids are powerful anti-inflammatory agents, and they can decrease inflammation and decrease your symptoms. These can include Flonase nasal spray, Rhinocort, Nasacort, etc. You can also purchase an antihistamine nasal spray, Astelin, Astelin. An antihistamine nasal spray, along with a corticosteroid nasal spray, works synergistically to decrease symptoms. Another option is adding an oral decongestant, which acts as a vasoconstrictor, closing up the diameter of the blood vessels so they don't leak so much fluid, such as pseudoephedrine or Sudafed. Another class of oral medications are the leukotriene receptor antagonists. These, in short, are anti-inflammatory agents also, such as Singulair and Accolate. If someone is having a major flare, a short course of oral prednisone, which is a very powerful anti-inflammatory corticosteroid, can relieve symptoms and get the patient back to baseline. The third thing you can do if you've been suffering with symptoms over the course of many months or many years is to see a specialist, including an allergist. An allergist can perform allergy testing to determine what you are allergic to and can also help fine-tune the medication regimen to relieve your symptoms. A second option is seeing an ear, nose, and throat physician. Over the course of my medical career, I've seen many patients who have suffered for years with symptoms of seasonal allergies or allergic rhinitis. They see the ENT, a CT of the sinuses is ordered, and it's discovered that there are anatomical abnormalities such as a deviated nasal septum, nasal polyps, sinus polyps, etc., that cause a mechanical obstruction of the passageways, significantly contributing to symptoms.